Hello, everyone, and welcome to Disability Voices United. My name is Christiana Morales. I'm the Director of Self-Determination Program here. And we have a great topic today. We're going to be talking about EVV, a presentation, but we do have a couple announcements to begin with. We have interpretation. So please go to the bottom of your screen to the globe and select your language. We have English, Korean, and Spanish. Even if you speak English, make sure you select English, or if somebody asks a question, it's interpreted, you won't hear it. If you're on a cell phone, go to the bottom of your cell phone, there are 3 dots, and select those 3 dots, and that will take you to where you can select your interpretation. So we have a few announcements to begin with, and oh, somebody said they can't see anything. So our wonderful Zoom wizard today is Kira. So Kira will reach out to help you with that. So our first announcement today is we have the North Los Angeles Resource Fair and more coming up. I'm going to share my screen. I know it's not the perfect share, but it's coming up September 23rd. It's going to be a resource fair and more. So we'll have the vendors for the resource fair, but we're also going to have speakers coming out who are going to share their experiences in self-determination. And we're also going to have some small group roundtables where you can sit down and talk to experts, and you can bring your own personal questions, or even if you're new to self-determination and you want to learn something more about it, this is a great opportunity for you to come and meet people who are in it, ask some experts, and see all the great opportunities that are out there for that you can use as supports. The link for this flyer is going to be in the chat, so you can get that. We also are signing up vendors for the same resource fair. So if you are a vendor and you are interested in sharing, you can get the link in the chat as well. We are also starting to host Disability Voices United. We are going to be hosting a local advisory volunteer committee member collaborative. And it is going to be the first Tuesday of every month. Now, this meeting is just for people who are committee members, so local advisory committee members. So if you are a member of a local advisory committee, we are inviting you to come and join us. We're going to get together so you can meet other members. And this is actually going to tie in very closely to what Judy's going to be presenting about, a new directive that came out. The newest directive that came out on July 20th has to do with the local advisory committees. The directive link, if you don't have a copy of it, is going to pop into the chat right now too. And I want to introduce Judy Mark, our amazing president of Disability Voices United, and she's going to explain what this directive is all about and what it means. Oh, Judy, you're muted.
Hi, everybody. Great to see you all. I'm just gonna get, you're gonna put that in the chat, right?
Yes.
So that people can see it. All right. So I just want to spend a minute because I know that many of you are members of your local volunteer advisory committees. It's also called LVACs. I hate that term, but your local volunteer advisory committee, every regional center has one. And they have been very clearly defined in a new directive. For those of you who have been part of it, you've known that you've been having to follow what's called Bagley-Keene, which is an open meeting rules. And this particular guidance, which just came out, is going to supersede that. Supersede means that this directive basically says, follow this new information and forget about all the old information, okay? So in legal terms, that's what supersede means. So that means that local volunteer advisory committees are no longer under Bagley-Keene, but they do have a set of a guidance from DDS that includes ensuring that the meetings are noticed to the public at least 10 days in advance. But you'll also see in the guidance, if you click on the link, that the DDS uses terms like should do this as opposed to shall. And I'll give you a little lesson in laws. When you say should do something, that means it is highly recommended, but not required. When they say shall do it, you better do it or else you're in trouble. And so all of these recommendations use the word should. And the reason why DDS used the word should is because the local advisory committees are just that, just advisory committees. They do not make policy, and therefore they don't have the same requirements that a regional center board of directors would have, or any of the committees that are officially under the regional center boards of directors. What it also means is that your local advisory committees can continue to meet as they did during COVID. They can continue to meet during remotely on Zoom or whatever platform remotely. Has the link gone into the chat of the guidance, Christiana?
I'll put it again just in case.
Okay, yes, because it looks like people maybe came in a little bit late. So if anyone has any concerns or questions about this guidance, you should feel free to reach out to DDS and ask them questions. You can also feel free to reach out to our organization, and we'll try to help you if there's anything confusing in it. That's all. Thanks, Christiana.
I just popped the directive in the chat in case anybody didn't get it. So our presentation today is about EVV, and I'm going to make sure I get this right. Electronic visit verification. I'm looking at, good, I got a thumbs up. So sometimes with the acronyms, I even forget what they mean. So I wanted to make sure I got that right. So I want to introduce our presenters today. We have Jennifer Parsons, who is the EVV Program Manager from the Department of Developmental Services, DDS, and Karina Cruz, who is the Program Analyst, the EVV Program Analyst from DDS. Welcome so much, and thank you for coming. And I did want to say that I did have an opportunity to reach out to a couple financial management services to kind of see where they're at. So after you share your presentation, we can talk a little bit about how it's going to directly relate to self-determination and kind of where we're hearing things are going. So welcome, Jennifer, and thank you.
Yeah, thank you so much. We really appreciate the invitation. Karina just had a little bit of a connection error, so she's going to try to join in a minute, as happens when we do things over Zoom. So appreciate your patience. But we really do appreciate the invite so that we can bring you some information about electronic visit verification and what that means for the self-determination program. I'm deliberately talking loud and slow because I was told my microphone is a little bit off. I want to make sure everyone can hear what I'm sharing, and that the interpreters can hear me and can pick everything up. And there's Karina. Karina, if you'd like to say hi to folks.
I am available for any questions in our email.
Thank you, Karina. And as I was introduced, I'm the program manager here at DDS for electronic visit verification. The reason I think it's important we say hi and that our cameras are on is that I'd like you to know that when you do email us at the department with any questions about electronic visit verification, your message comes directly to Karina and I. So we would be your contacts. We're the folks that can help you out if you have additional questions, or you'd like resources, or you'd like to be put on any notification list for electronic visit verification. Karina is going to put our email address in chat. It is just for electronic visit verification. You're welcome to use it for any questions relating to that. I am going to share my screen and we'll go through a brief presentation that explains electronic visit verification. This PowerPoint has been made available to Disability Voices United, and so you have access to this in English and Spanish should you need it. I bet they can put that right into chat for you. So again, we really appreciate the invitation. What we're going to talk about is the fact that this California, what it looks like at the regional centers, electronic visit verification in the self-determination program, provide some next steps and some resources. And I saw my internet got a little jumpy, so I may turn off my camera if that might help, although I do like having cameras on, but give me another hint if I need to turn it off, please, Christiana, I'd appreciate it. So EVV is a federal requirement. It's part of the federal 21st Century Cures Act, which states that all the states need to set up a system that electronically verifies when personal care and home health care services are provided in somebody's home. The federal government put that into place to make sure that people are getting services that they need, and in order to prevent fraud, waste, and abuse of the federal funding that they're paying for home and community-based services. There's many different ways to implement electronic visit verification per the Cures Act. And so we've worked with Centers for Medicaid and Medicare Services, it's also known as CMS. And we started talking to doing outreach pretty early on with stakeholders, like in 2018, to understand what would work best for California. So when we are implementing the federal requirement, California chose to use an open model approach. And that means that the data that's required, which we'll talk about here in a second, can be submitted to the state in many different ways, as long as the system that you're using or that's being used is able to communicate with the state's system. Well, what's being communicated? What's being sent? The Cures Act specifies that there's 6 data points that need to be captured at the time that the service is provided in the person's home. So the things that need to be captured as a part of this electronic visit or electronic record are the type of service being performed, the individual receiving the service, the date of the service, the location of service delivery, the person providing the service, and the time the service begins and ends. It is only those points that California has put into place in our system. Looking at, I am going to expand a little bit on EVV across the nation and in other states. California put electronic visit verification into place outside of billing and outside, it will not change how services are provided. And so I think that's important, because if you're doing some research on electronic visit verification, I encourage you to look at the California websites about that being implemented. Looking at other states, we've had some phone calls where people were very concerned and confused. So I think we'll go into a little bit more about that, but please look at the websites for the departments that you receive services from. So for example, California is implementing with others, or Department of Developmental Services is implementing electronic visit verification in partnership with other state departments. You may receive services from some of these departments, like Department of Healthcare Services. So if you are on maybe the aging waiver, or receive services through waiver agency, which is, can be done in collaboration with your regional center services. That's all under DHCS, right? Department of Healthcare Services. The California Department of Public Health, the California Department of Aging, and California Department of Social Services in some limited counties. All of those departments, including the Department of Developmental Services, are using a system called Cal EVV. It's a branding name that we gave to our system to help identify it as a unique system that we've purchased from a vendor, from a contractor called Sandata. But if you hear Cal EVV, that references the Department of Developmental Services and these other 4 departments listed here in the top 4 bullets. But electronic visit verification is also being implemented for in-home support services. And most folks that receive services from a regional center also have in-home support services. In-home support services is implementing on a different timetable and with a different electronic system. So if you have questions about in-home support services and how electronic visit verification works with that service delivery, there's some resources here, and I know Karina will have them in the chat for you as well. But you'll want to visit their website, which is listed here, because they have some recorded trainings. They've got some informational webinars, PowerPoints, and they also have FAQs on that website. Additionally, if you have other questions, you can email them at evv@dss.ca.gov. The email here on the screen that Karina will also drop into chat for us soon. You can ask them questions. You can also ask to be added to their notification list if you'd like to be kept up to date on things that change for in-home support services and EVV. Thank you, Karina, for doing that. So let's take a look. We took a look at electronic visit verification federally, that it's a requirement that's put into place by the Cures Act. We talked a little bit about how electronic visit verification is being put into place for California. But let's take a look at what electronic visit verification means at the regional centers. So electronic visit verification, as I said, is for personal care services and home health care services. So not all the services that everybody receives require electronic visit verification. In January 1st of 2022, these services at the top of your screen, respite, SLS, personal assistance, and homemaker, all began sending electronic visit verification data to the state. In January 1st of 2023 is when we implemented the system for home health care services, for nursing, home health, occupational therapy, speech, and physical therapy. Now you'll notice these are all traditional service codes, right? The way that the Department of Developmental Services decided to implement electronic visit verification was to learn as much as we could by implementing it in the traditional system, so it could help us understand how the data worked and what kind of outreach worked really well, and what kinds of questions people had. And so we helped these programs implement or start electronic visit verification, and we learned quite a community implement electronic visit verification. So if you have friends or providers that you know that don't know if they need to do electronic visit verification. There's a guidance document that is on the department's website that Karina can put into chat for us that lists all of the services that require electronic visit verification. We are going to capture those 6 data points for services provided in the home. So I'm going to take a pause there. I have not been looking at chat, so I'm going to ask Karina to let me know, and or however that works, Christiana, in your group, if there's any questions about electronic visit verification and the CARES Act, how it's maybe operating in other states, how it's operating in other departments in California, or any of the information about the traditional service codes that we've put into place for electronic visit verification at our regional centers.
We actually had one question that I thought was an interesting one, and they wanted to know, what's going to happen with this information, and is it going to be sold?
That's a really good question. I know there's a lot of concern about data privacy and information being shared. And no, this information will not be sold. It is protected by HIPAA, by many federal privacy rules, security rules that we're required to. They're not required to. There we go. So not only are we required to follow those stringent security rules and privacy rules, we have to report to the federal government each quarter how well we're following those rules. And so the information is not sold, and we take it very seriously that that we're protecting your information and reporting to the federal government how we're doing that and the success we're having with that. Are there any other questions that folks have? Either you want to put that in the chat, or like, again, Christiana, if there's anything that you wanted to send my way.
So typically what we'll do at the end is we'll let people put questions in the chat, and then they can raise their hand. And we kind of go between the two of them. But if you want to kind of stop in between, if somebody has a question already, please feel free to raise your hand. Robert, you have a question?
So sorry. My question is, EV, it says electronic visit verification. So for all regional centers, is that throughout the whole state?
Yes. Yep.
Okay, so
it is, Robert. Yep.
Even though I provide services for the Alta Regional Center here in Sacramento and in the Davis clients, where I provide services, and even Citrus Heights, so all those clients who are part of it, they would be affected with this, with the electronic visit verification at all.
Yes. Yeah.
The regional centers. And then, yes, of course, it started in 2022, began with personal care services, but then you said January 1st this year, it started beginning for the home health services. So what's going to happen after that? So what's the next step? Is there any more?
Yep, we're going to go and look at the information and which services in the self-determination program are required to have an electronic visit verification record. These services are all the services in the traditional system, and that's already been implemented and already in place. And we're going to look at the services for self-determination next that, that need to have electronic visit verification for services provided in the home. So that's coming up.
Debbie, we'll get your hand next, and then we'll get back to the presentation so we can get through it. Debbie, do you want to unmute?
There, got it. Sorry. I'm wondering for like a supported living agency that's doing primarily stuff in the home. We had a situation come up where the worker is actually picking up our son out in the community from someplace else and then taking him home. And in the system that they use in the agency that's been serving him, it's kind of clunky. Somehow they can't sign in themselves, sign into work out in the community. They have to be at home. Could you say anything about that?
Not being familiar with the system that they're using, Debbie, what I can say is that the department would expect to see electronic visit verification data, those 6 data points, only for services that are provided in the home. So if he's unable to log in the community on that system, then he should work with his employer to understand why the system they're using is doing that. It could also be that it's just designed to capture the cure's minimal required information, which is the home services. So if that staff person's shift is a 6-hour shift, and 2 of those hours maybe are in the community because maybe they run an errand and then come to your son's home, we would only expect to see an electronic visit verification record for the time that was spent in your son's home. That's the cure's requirement.
That's interesting. Okay, thank you.
You're most welcome. It's a good question. So taking Christiana's lead, I'm going to go on to the next part, which is talking about electronic visit verification in the self-determination program. So what does that mean for folks here who are in the self-determination program? These are the services, Robert, if you provide services, community living supports, homemaker or respite, nursing, home health, speech, hearing, language, occupational therapy, and physical therapy, if you provide those services, then electronic visit verification is required when services are provided in the home. Okay, so on top of the traditional services we just looked at, these are the services in the self-determination program where we would expect to see a visit record. There are some exceptions, and we'll take a look at those as well as we move on. But overall, if a service is provided in the home, this is when we would expect to see a visit record. When I talked about we implemented the services in the traditional system so we could learn, this is a little bit about what I'm talking about, because as we know, self-determination can be done in many different ways, right? There's 3 different financial management service models. And even if you're in a specific model, you can have services in a couple of different ways. So whoever the employer of record is, right? Whoever's the boss of the employee can sometimes change even if you are receiving a specific model. So the next few slides, we're going to talk a little bit about who's responsible for what and depending on the way that you get your services. So I'm going to turn off my video because I don't want to crack up during this part. It's a little bit in depth, but I think it helps explain who should be doing what and helps folks understand how electronic visit verification works in the self-determination program.
Jennifer, before you get started, Tim has his hand up.
Absolutely. Hi, Tim. Yep. So however that speech therapist is paid, that will determine how they collect the visit data. And that's what I'm going to try to go through in the next few slides. But yes, you did grill me really well over breakfast when we were visiting. And I appreciate that because it helped me explain it on calls after we had breakfast. I had to explain it on many different phone calls. And so you gave me good practice. So hopefully I do it justice again here. But if not, I am open to hearing questions so I can continue to get better. We're going to start with folks who receive services in a co-employer model. And that means the services are the co-employer model. So the FMS is the employer of record here, right? So when you have staff that come and work with you, their actual employer of record is your financial management service. So let's start over on the left-hand side, and each of the blue boxes are the people in that payment chain and in that responsibility chain. And underneath that, in the white boxes with the black print, says who is doing what and a little bit about how. So I'm going to start at the left and read across to the right for services that are paid as a co-employer. And again, I'm going to turn off my video, which may help the connectivity. So on the left-hand side, we see the blue box that says staff. So the staff are the people that come out to the home and provide the service to the participant in the program. The staff provide the service, and they are responsible to collect the EVV or electronic visit verification data during the visit when they're providing service. Remember, those 6 data points have to be captured at the time the service is delivered. That's the purpose of electronically verifying the visit. So that's the staff's job. The provider, which in our service delivery system, right, at the regional centers, the provider is typically a vendor. But you can see here in the co-employer model, those services that are paid under co-employer, there is no service provider, right? Because there is no vendor, because there's no employer of record other than the financial management system, financial management service provider. So there's no role here for the provider under co-employer. Moving over to the right, what is the self-determination program participant doing? What is their role? They select and direct the staff. Nothing changes. In the co-employer services model, the participant decides who's going to work for them, and they tell them when they're going to work, and all of that stays the same. Nothing about service delivery changes. When you go over further to the right, the blue box that says FMS provider or financial management service provider, again, they're the employer of record or EOR for the staff that the participant selected. So it's the financial management services provider's job to select and maintain the electronic visit verification system that they choose, and to maintain all of the data that comes in. That system that they pick to use to capture those data elements, those 6 pieces of data, they're going to send, that system is going to send the data to the state under their financial management service vendor number. A vendor number is an ID number that is given to all vendor providers with a regional center. And as we know, the FMS provider in the self-determination program is the only required provider to be vendor. So that's why all of the data that's collected for electronic visit verification will always be linked to the financial management service provider's vendor number. And then moving over to the right, the reason we need to do that is because we have electronic visit verification federal reporting. When the electronic visit verification data, those 6 data pieces come up to the state, we match that information against federal claims that we've submitted for payment, for reimbursement. So it's important that the claim information for the federal dollars matches the information that the FMS is sending to the regional center for their payment to then pay your staff. So that's a lot of information, but we went left from right. All the blue boxes are the folks that have the different roles and the different entities, as it were, in co-employer services. And underneath that is the information about who is doing what they're doing. The next slide, I'll go a little faster on because it's the same setup with a very few changes. And this is how it works under sole employer services. So if you are using the sole employer financial management service model, and you have staff where the participant is the employer of record for the staff providing the service, this is how it works for those folks. Again, starting at the left, the staff have the same role. They provide the service and they collect the electronic visit verification data when they're providing that service at the house. The provider, again, a vendor provider is not a role in the sole employer service model. So there is no service provider role here. Moving over to the self-determination program participant, the participant is the employer of record for staff. And that means the participant has the responsibility for electronic visit verification. But they also have choices in how they want to do that. So they still select and direct their staff just like they normally do now. And they have a choice to use their financial management services electronic system, or they can choose to use a separate system. The choice that they make in how they want to manage their electronic visit verification, that will determine their level of electronic visit verification responsibility. And I've met with several people who want to talk about what that means and what the choices look like. And I'm happy to schedule any phone calls with anybody who would like to talk more about that. We could just take your email and we'd schedule a call with you because we want you to be able to make an informed choice. So what is the financial management services provider's role here? Their job is to connect self-determination program participants to the resources. So if you didn't know how to contact the department to get assistance, the financial management service provider would help you. If you have decided that you're going to use the financial management services provider's system and you don't want to go get your own, you don't have to. Then the FMS provider will select a system for you and they're going to maintain it and they're going to send the data on your behalf. That system again sends the visit data to the state, and again that data is linked to the FMS or the financial management service provider's vendor number. Again, the purpose of the connecting to the financial management service vendor number is so that we can match federal claims when we report to the federal government. Lastly, bill payer services. And I say this to last because you can have bill payer services regardless of the model of financial management services that you have. If you have co-employer, you might have some bill payer services in there. If you have sole employer, you may also have some bill payer services in there. But here we have an additional role. We have a provider role. And this is where a provider is the employer of record for the staff. And that's how you know it's a bill payer service. So again, let's start from the left. The staff have the same job. They provide the service and they collect the EVV visit data when they're providing that service. The role of the provider, they're the employer of record for the staff coming out to work with you. So it's their job to select and maintain electronic visit verification systems and the visit data. Their system will send the data to the state, and the data that they collect for self-determination program participants needs to be linked to the financial management service vendor number, because at the end of the day, that is what will link to the federal claim for those services. And so we worked with a few providers in this situation and walked them through what that looks like. And so far, so good. If we've hit a technical problem, we're working through that with them as well. But here, the self-determination program participant selects and directs the service provider. The FMS provider's job is to connect that provider to the resources that they might need for electronic visit verification, again, to support the matching that we're required to do to report to the federal government on some specific data points that we need to report on. I see that we have a hand raised. I'm good to pause here because that was a whole bunch. I'm going to try to come off video. Hopefully my connectivity will remain good.
Miriam, would you like to? Oh, there you go.
Under the same codes, yes. Under two different codes, yes, but we'd want to know that that's intentional. For example, if someone is providing respite to two siblings, we would call that a group visit. It's intentional that there's one staff person with two people receiving services. That's called a group visit. So you'd want to talk to whichever system you're using, you'd want to talk to them to figure out how they identify that a group visit is happening. Now it can go the other way, right? You may have two or maybe three staff at one time working with one participant. That's also called a group visit, and that's also okay, right? Because electronic visit verification won't change how services are delivered. It's just going to give us an electronic record of what was delivered, when, to whom, and those 6 pieces. So the short answer, Miriam, is yes, and that was a little bit about how. That's correct. That's correct. You would want to identify that it's a group service though, because the intent of electronic visit verification, right, is to prevent fraud, waste, and abuse. And so if there was 2 services happening at the same time, we'd want to know that that's intentional and that's supposed to happen. And so you would want to, it depends on the system that you're using, Miriam, to collect the information. So if you are you using the FMS's system to collect your data? Then you need to ask the FMS, how does the system recognize a group visit? And if they need help, they're more than welcome to reach out to Karina and I, and we'll help. Because I don't know the system, but to your point, thank you for bringing up the exception. If the staff lives with the participant receiving services, they are not required to do EVV. And there is a form, thank you for mentioning that, Miriam. We'll have Karina put that in the chat, the guidance and the form that needs to be filled out. But because we know some use and they've selected you would need to work with them to determine if that information goes anywhere. So while it may be capturing the GPS because that's the system they've selected, or if they can turn it off for specific caregivers, I don't know. But I do know that the state would not expect to see visit data for that staff person collecting the information because you've got that form that you filled out that says this is a person that lives with the participant.
Jordan, do you want to unmute?
Okay, thank you, Jennifer. This is Jordan Feinstock. My first question, too, is obviously it has to be done in the home, and I'm sure you understand that self-determination a lot of times may start and or end in the community. So that would wipe out any EVV in that case. That would wipe out any EVV because you're in the community. And as far as I remember, they can now do it on a cell phone. But when you're in self-termination, you have to approve your employees' hours when you get your, the timesheets, and then you have to approve their hours. So you can't really see what they're doing. Hopefully they're being honest. And I don't know what trumps one or the other. But again, EVV can only be done if they're in the actual home. And so you could do it one way. So they could start start in the community, and then they wouldn't log in. They would only log out. Because if they pick you up, like this gentleman said, from and Go Aggies, UC Davis, picked you up somewhere in Davis and then dropped you off at home, or then they would only log out, they wouldn't log in.
Well, they came into the home at some time, right, Jordan? So
they just dropped you off. I'm just saying they just dropped you off at the home.
Yeah,
that would be the end of their shift. They would just log out.
Yeah, well, so their payment system may or may not be tied to electronic visit verification.
Okay.
So if they're already logging in and logging out, which it sounds like Miriam's, that's the kind of system she's using, regardless of whether EVV is needed. It sounds as if Miriam's financial management service provider has staff using an electronic system anyway. So in that situation, if none of the visit is provided in the home, the department would not expect to see an electronic record for that visit, but you'd still want your staff to log in and out for payment. So That's something you'd want to double check with your FMS about how that works.
And lastly, if we're going to go back to what you said earlier, I know we're not talking about it, but if you're got IHSS, and what is I guess there probably isn't none right now. What's the punishment if someone's actually in your home but doesn't decide, or you never use the service? Just no one's using the EVV. Is there any punishment, like if you know that someone's actually in the home because of IHSS, they're in the home, but they don't log in, log out, and even if you tell them they still don't do it. They do the hours, they don't log in. Is there any requirement that, oh my God, you didn't do it, so you're now get the axe, or just nothing can really happen? It's just more of a courtesy to do it.
Well, it is a requirement, not a courtesy. However, I cannot speak for IHSS, but what I would encourage you to do is to send them questions to that email address, because they just started implementing their system on July 1st. So they've got some learning to do as well. They would probably want to know that question. But I can say for the department and for any of your regional center services, if someone is struggling with remembering to log in or out, we understand that. As adults, we sometimes are slow to learn things and do things that are new. So it could be that someone will get that, and got some flyers to help remind them, and we've got those on the website. So if you're looking for some resources to share with staff, or maybe your staff aren't comfortable doing that, we invite you to have you and them to attend any of our office hours that are on our website and come talk about that. And we can provide some support until folks understand why it's needed to be done, that it is a federal requirement, and that, which means it's the law, it needs to be done. To your point, at this time, we're not focusing on any kind of penalties. We're focused on training and education, and why are we doing this? And that's what we're focused on. If any of that changes and you'd like to be made aware of when that changes, you can have us add your name to our notification list. And when we have any updates about electronic visit verification, you'll receive a notice. Jordan.
Thank you.
So
You're welcome. Thank you.
Mary and Lulu, I'm going to ask you to keep your hands up, but Jennifer just had a couple slides. I want to make sure she gets through all of her slides, and then we'll get to you next, we promise.
And they're very simple slides, quite honestly. This one talks about next steps. I know we mentioned it a little bit before. If you're not sure about how your services work with electronic visit verification, or we had some very specific questions about the systems being used, please reach out to your financial management service provider. And if you ask a question and they don't know the answer to it, or they're not sure, they're more than welcome to reach out to the department. We've talked to financial management service providers because a lot of them also have traditional services, right? And so we've got some relationships already going with them in that world, and we're happy to help them get this on board as well, and help them understand what's required. For everybody, use the online resources that are available, and I appreciate all the questions being asked. Like I was Tim, he grilled me pretty good on some questions, and it helped me understand what the questions are out there and how we can maybe enhance our frequently asked questions document. Our FAQ has like turn off my camera. Yep. I just saw that I was freezing up. I will say that the DDS electronic visit verification webpage link is here, and Karina will drop that into the chat. It's got all of our meeting information on it, previously recorded webinars that we've held. The October 25th of 2022 webinar talks about this same exact thing. So if you wanted a recording of all my my goings on here that I've just talked about, you can hear me say it all over again in that webinar, that recording. Anybody can contact us at the department if you want additional information, or if you need links to resources, or if you want to be added to our notification list. We're happy to let you know about the things that are going on. And we're available to visit any local volunteer advisory committee. Meetings like this, other venues for self-determination, or traditional services for that matter, to provide information about electronic visit verification. We've been to several regional centers, several local volunteer advisory committees, but we know there's more out there that are just hearing about this, and we're happy to come chat. And then again, this is a list of all of the resources. Karina has been putting these into chat. But we're gonna keep this up so people can take a look, and she can copy and get these all into chat if you'd like them. But again, the document is available from Disability Voices United, and the links will be in that as well. And those were all of the things. I'm going to keep the resources up while we take some additional questions.
Awesome. So we'll take, oh.
Thank you. Thank you. The department put out a guidance document. We put that out in the middle of April, and we had every service needing to be compliant or needing to be doing EVV traditional and self-determination as of June 1st. But again, to Jordan's point, right now, we're focusing on training, and we're focusing on making sure folks know that this is what they need to be doing. There's not a penalty for that at this time. But June 1st of this year, 2023, was the date that we put forth. Thank you. That's, again, a really important question. There have been no hacks on any of the data that we've been collecting since January 1st of 2022 that have been reported to us or that we needed to report to the federal government. And the other part about tracking, if you're using the system, and if you're using most other systems, they only capture your location at the time you log in or the time the staff person logs in. I do this because this is my phone. The time that staff log in, they capture location, and the time that the staff log out of their shift, it captures location. It doesn't track in between, and it's not required to track in between. So similarly, when you go and maybe you look at the Home Depot website or a Walmart website or Amazon, and your location is identified when you have the app open and when you're looking for a local store. And then when you log out of the app, it no longer tracks where you are and what you're doing. The app that the state has selected to use for the state's free system, that Cal EVV system, operates the same way, as do most software systems with using an app. The other option is you can call in, and if you don't want to use the app, thank you, Karina, you can use the phone to call in and do EVV visit data collection over a phone. And it's like calling into your bank and making a selection choice for logging in and logging out.
So we usually like to alternate between our hands raised and our chat questions. So Mary, you've been very patient. Go ahead and unmute. Hi, Mary.
Sure, and we get a lot of questions about that because there's services should be wherever they need to be, right? And you shouldn't change how services happen just because of EVV. That is not the intent. It is directly from the Cures Act that says when these services are provided in the home. So interpreting that, that's the minimal data that we would expect. Again, in other states, they're collecting they're collecting information all of the time, but California looks at when services are provided in the home because that's what the federal government said in the 21st Century Cures Act. So if you have a service that's paid as a personal attendant for your daughter and they don't come into the house, they don't go to her house, we wouldn't expect to see a record. Sure, we wouldn't expect to see a record, an EVV record, and visit information for services that aren't provided in the home. So if there's a physical therapist or maybe an occupational therapist, and that's all in a clinic, that wouldn't require electronic visit verification either, because it's not in the person's home. There's choice with that. Let's say they're going to go in and out of the home. Well, that would be extremely frustrating for her to be logging in and out, and that becomes burdensome. So what we'd recommend is that she log in once and log out once, and that's okay too, because it's not going to track in between time. It's not going to track where she goes, but that staff person doesn't have to log in and out. It's the home time. It's the service in the home is what's minimally required. But if she logged in at 8 a.m. and spent an hour at the house, they go out, run errands, come back at 10, have lunch, go back out, and an 8-hour shift could do that. We would expect to see at least the time in the home, but to be minimally burdensome, to not be burdensome on the caregiver and the services, she could log in and out once, and that would be fine. You're welcome. It's a great question. Thank you.
Lulu, you've had your hand up.
My question is, as a parent, can I have a communication iPad, and like an iPad actually to record those visits for staff? Would that help for employees that don't want to put in their personal data? This is something that could work using an iPad. And then, so for each staff member, they would have their each account number. So they do check in, check out using their ID number. Would that be something that works?
That's a good question. And if your staff is using the state's system, any device that can download an app can be used. And yes, each staff would have a different login. So the same device could be used for multiple staff if you wanted to do that. If you're using a system that is not the state system, I would talk to your financial management service provider to see if an iPad would work for logging those visits for multiple staff.
So Kira, do you want to read some of the chat questions for us?
Hi, Christiana. Absolutely. So I have quite a few questions here. One of these questions was asked anonymously, and this question is, how does the electronic visit verification precisely work for the services provided remotely and virtually through the SDP? Thank you.
Another good question. And I'll go right back to the Cures Act. That service is not provided by the provider in your home. It's being provided virtually. And so we would not expect an electronic visit verification for that teleservice.
Thank you. I'll go ahead and, my camera was not on, ask another question. Let's see, this is from Nirmala at 5:25 p.m. I apologize if I've mispronounced your name. The question is, when should this electronic visit verification data filing start? Is there a start date? Could you please review the important dates?
Yes, we would expect folks to start now. If this is the first that you're hearing of it, I'm glad that we're able to share, and we'd like to get you started. So if you are a parent or a participant, or a provider and you're not sure where to get started, contact your financial management service provider and ask, what system are you using? Are we already doing this? And ask them questions. And again, if that financial management service provider needs assistance, they should reach out to us. But we expect this to have started. That directive said June 1st of this year. So we're hoping to increase our outreach, make connections with folks like you that may not have heard of it before. So that's the date that we have right now that is most important.
So I'll jump in real quick and say that I did speak to a few financial management services, and what they said was they are working on it right now. So they were hesitant to come speak today to say, this is what we're doing, because they said they were kind of rolling it out, and that it wasn't something where they could start a few people and then, add. They said it was kind of, you turn it on or you turn it, all at once. So they were trying to get their ducks in a row. But I do know that most of them are working on this and reaching out to their to the participants to explain how it's going to be functioning as they're getting to that point. So we are seeing it start to roll out.
Can
Mari,
I add something here?
absolutely.
Since the majority of people in the self-determination program use GT independence, I can tell you that that I received an email from GT Independence on November 1st of last year, talking about their new EVV system, and that it went into effect on January 1st, so earlier than the requirement, and that it's very easy. It's done all through the GT Caregiver app. So if you have any employees who are using that app, you are already using the EVV system. So since about 60% of the state is using GT, you're already in this and you don't even know it, because as a family member or a self-advocate, you may not even know that your staff is already committed to using this. The one thing that I can say is that if your staff forget to clock in or clock out, it's not a big deal. They can just go back in and put their times in. And even though the GPS wasn't working for that, it's okay. So I think that at least in this case, it's working pretty smoothly.
Thank you for sharing. That's such a great point. And that's what we were hearing from the other ones as well. It's going to be in the app. It's going to be very in the background, that the participants really, it's not going to be very burdensome for them. And especially that forgetting to, because everybody, as you're learning something new, we know mistakes are going to happen. And so they're going to be very patient with people putting them in if they forget, and as we learn the new systems. So.
And I just put in the chat information from GT Independence about their caregiver app and how it uses the EVV system, they call it EVV compliant.
Awesome. Perfect. Mari, do you want to unmute?
So electronic visit verification, that information should be captured when the service is happening. If you're using the state's system that we've purchased and made free and available to folks to use, if they don't have a cell phone that can download an app or don't want to, they can use a landline or phone to call in and they could log in and out via, this is my phone, either it's this is my cell phone or this is my other phone. They can call in and log their visits using their voice in a touch tone phone. If you're using your financial management service provider's system, you would need to talk to have the information at the service. Sure. The purpose is to capture electronic visit verification. I'm using your financial management services system. You need to ask them what other methods might be available. If they don't, yeah. Yes. You're welcome. Thank you. Sorry, I was breaking up.
That was a great question, Maury. Michelle, do you want to unmute? And then we'll get to some more chat questions after. Michelle.
So the first question was about someone's working a shift and they're going in and out of the home. And the answer to that was EVV is required for services that are provided in the home. So if someone works an 8-hour shift and half is in the community and half is in the home, the minimum data we would expect to see is the time that was spent in the home. However, if this shift has the staff member and the participant going in and out of the home all day, it is difficult to log in and out, and we wouldn't want people to stop to do that. So in that instance, they would log in once and log out once, preferably at the beginning of their shift and at the end of their shift, even if in between those times, they were in and out of the home. That makes it a little bit easier for folks to do, and we understand that, and that's okay. And to your second question, you talked about, I think I lost it, Michelle. I lost your second question in my brain. I would appreciate a prompt on that.
I believe, John, it was whether employers are required to pay for the phone because they are clocking in and out. And knowing a little bit about this issue, actually the answer is yes. If you are requiring your employees to use equipment for any reason related to their job, you are supposed to at least pay some portion of their cell phone bill. Now, it might be a tiny little bit since they're just using it for a few minutes each day, but you are, according to California law, labor law, supposed to do that. That was an excellent question that I'd never thought about. Yeah, so you just need to pay for the person's phone use for the amount of time you require them to use it. They could also use a computer at your home to clock in and out as well. So, you know, I don't know. This is a technical question that maybe I'll try to get one of our board members who's an expert on this stuff to answer. Yeah, so let us try to get this answer, unless Jennifer, do you have any other information on this?
I can't advise folks who are employers of record on labor laws or anything like that. So I appreciate that you're offering that to your folks.
Yeah, we'll try to get that information and talk about it at the next SDP Connect.
Jennifer, see, we get great questions here, don't we? We
Yep.
have an amazing crowd. Kira, do you want to ask some of the chat ones so we can make sure to get those in here too?
Sure, absolutely. So someone was asking L at 5:23 p.m. to please send the federal website where it states that EVV reporting is a requirement. There was a link put in earlier, but I did click on it myself and it had an error. So maybe just making sure the links that we've dropped are working.
Yep. Karina, can you go to our website and take the CURES link either off of one of the guidance documents or off of our information or off of our About tab and drop that into the chat, please?
And folks are also asking what CURES and CURES Act stands for.
CURES is actually, to my knowledge, not an acronym. It is the CURES Act. It doesn't stand for anything. It is a hefty chunk of legislation that did a lot of different things. And only part of it is the electronic visit verification. I printed it out, which was a terrible waste of paper, and it was like 300 pages front and back. And the CURES, the EVV portion of it turned out to be about 4 of those pages. So if you open up the CURES Act and you have it in a PDF document, which is generally how it will open, if you hit Control F on your keyboard and look for electronic visit verification, that will absolutely narrow it down for you.
Wonderful. All right, so I'll ask one more question. So let's find a good one here. Someone was asking, so if the SDP Service Code of Community Living Supports Services takes place outside of the home, then EVV, electronic visit verification, is not required, correct?
Correct. Shortest answer you're ever going to get from the department. Yes.
Do you want me to ask another one, Christiana, before? Okay, let's do another one.
And we have quite a few in the chat, so we want to make sure we get them.
Okay, let's see. There's another one from Allison at 5:31 asking, rather than wait for an invoice from the provider, at the end of the shift, I sign the worker's log confirming they worked the hours. Under EVV, is there any verification for the parent that the time is correct?
The CURES Act did not require anybody to sign to approve it, approve the time. It didn't require any authorization. And so the way that California implemented it separates it from billing. So you should continue to do any approvals and things that you're normally doing. And EVV is completely separate from billing, which also means different in California than other states. You should continue to bill as normal and EVV will catch up to it after it's been paid. We're not denying money going out the door because of EVV not having a visit. And that's different in other states. So I think that that's a big caveat that we're also often asked. So keep your timekeeping systems and approvals and processes separate from EVV. Even if it's on the same device, don't let EVV change what you're doing for your timekeeping.
Wonderful.
I think that's a really, really good point to focus on, that we're not saying that if they don't work in the home, you don't need to track their time.
Correct.
So we just don't need to track the EVV. You do still need to do all of your normal time tracking.
Correct.
Kira, do you want to ask one more and then we'll go to Mary?
Yeah, I'm trying to find someone who hasn't asked a question already. I think this one by Krista Rose at 5:46 asks, what about a staff needing to clock out when dropping a client at services in the community and being picked up by another in the community?
Sure. So that if the first staff person didn't provide any services in the home, they picked them up at the doctor's office, ran some errands, and dropped them off at the movie theater. None of those services were in the home, so we wouldn't expect to see an EVV visit. And then maybe the personal assistant shows up at the movie theater and they're going to catch a movie together. And then after the movie, the participant gets on the bus and goes home, and the staff person goes home. We wouldn't expect EVV for that service either, because neither of those services had a portion of that provided in the home.
And I want to ask just one that's fairly related because it's from Kyung-shil at 550, who asked, if my child goes to the personal assistant's house and stays there for several hours to receive the service, should the personal assistant collect the EVV data?
No, we wouldn't expect it because it's not provided in the consumer's home. Now, if half of that visit was in the participant's home and half of it was in the provider's home, because maybe there's training going on, right, to transfer locations of a certain skill set, then it could be that we would see an electronic visit verification record that would span that whole time frame. But if none of the services are provided in the consumer's home, we wouldn't expect to see a Cures Act EVV visit for that time.
Can I point out something that I just saw on the FAQs from GT that I put in there? Because the way that I'm seeing GT is doing this is that they're combining the employees' tracking of time for payroll with the EVV stuff. So I'm not sure how integrated it is, but it just means that the employee doesn't have to do anything separate. They don't have a separate EVV check-in. It's just all one and the same. It says that you have to turn on in your phone, you have to enable location that when you have, so you can either enable it at all times, or you can enable it just while the app is open, or you can go in and out and enable it when you need to. So if you are worried about somebody tracking your whereabouts or your staff's, where your staff is, they can just turn on the location, go into the app, sign in, turn off the enable location until you have the end of the shift. Even if you're not at the home at the end of the shift, you still can, you can still enable a location or not.
Yep. I will add, Judy, for that, and especially with GT specifically, it sounds like their system is doing both things, timekeeping and EVV. Always timekeeping and payment will supersede EVV. So please keep that in mind, and please know that if something isn't captured for EVV, that's okay, because it's going to get paid in that system.
So we only have a couple minutes left. Mary, I wanted to get to, your hand was up. If you can, quick question.
I would recommend, Mary, learning about that system that your FMS is going to have you use. And then the 6 requirements for the Cures Act are nationwide, and it's start time and end time. It's not all the times in between. And so that's what we'd be looking for, is start time and end time, with a few variations depending on community and the mix of where you get your services. And we understand all that, and that's okay. But I would love to see you, Mary, get some information about how it works with that FMS, and then reach out to Karina and I, or through the email that she put into the chat, or to join some of our office hours, because we do have self-determination participants and families and providers join those office hour conversations, and it's very informal. It's just like this, and we answer as many questions as we can, because then maybe your system has something is wonky. It's not in alignment with what you thought you're hearing today or whatnot. We'd be happy to talk with you about it once we know a little more about it with you. Yes, you're most welcome. Good question.
So we have to end on time because of our interpretation. Thank you so much to all of our interpreters, for Kira for doing all the great work and keeping track of all the chat for us. I did want to let everybody know that our Disability Voices United conference is coming up. So we kind of wanted to put a save the date out there. It's coming up on November 3rd. Our theme is going to be Our Future, Our Fight, Our Right to Self-Determination. So we're looking really forward, and so we'll get some flyers out to everybody very soon. And thank you all so much for coming. Jennifer, thank you so much. That you did a great job explaining it to everyone, and going through our grilling, because we've got great questions, huh?
Yep, good stuff. Yep, I'm glad we did the traditional stuff first, and I'm happy to be here and be able to have information to share instead of saying I don't know, because that's terrible.
Awesome. Well, we will see everybody in 2 weeks for our next Connect. Thank you so much.